Hello and welcome to another segment of Western Wisconsin Journal. I'm Jamie Johnson, the government and political commentator, and today we're hosting two people from the St. Croix County Health Department, and I have Kelli Engen and Elizabeth, but she goes by Ellie Klasen. I hope I didn't butcher your last names too bad. First, is it Kelli? We have you on the screen first. Okay, and why don't we'll take you one at a time. Just introduce yourself, where you're from, and what your title is, okay?
Sure. My name is Kelli Engen. I am in the public health administrator, health officer for St. Croix County, and I am from a small town in northwest Wisconsin.
Okay. And Ellie.
Hi, my name is Ellie Klasen. I am the epidemiologist for the Department of Public Health at St. Croix County. And I actually grew up in Richmond, and I currently reside in St. Paul.
Oh, great. So you guys are both from the area anyway. That's good to know. So as far as you mentioned your titles, so I'll try to keep you straight. One's the public health officer, the other one's the epidemiologist. And just briefly, we're going to get into obviously the pandemic and COVID and how it's changed your jobs and everything, but just generally, what are your duties and responsibilities? And Ellie, since you're on the screen right now, we'll start with you.
Sure. So my duties as the epidemiologist are primarily dealing with the data of COVID, looking at the trends in our county as they relate to statewide, and as the numbers change on a daily basis, it is always assessing kind of the new cases in our county, the positives, the negatives, the sources of those infections, in helping coordinate with schools, making sure everything is accurate and up to date, as well as working in all the areas that the cases touch. So making sure we're reaching people in time and working with setting up our alert system. That primarily sums up my primary duties.
And before we go to Kelli, how long have you been in your position as the county epidemiologist?
So I was hired specifically for this position because the county recognized that, and especially Kelli, recognized that there was a need with the mounting cases in the county. And so I was hired in the middle of July.
In July, okay. Mm-hmm. Very good. Now, Kelli, how about you? When did you start, and your duties and responsibilities generally?
Sure. So I started at St. Croix County Public Health in October of 2018. So 2 years and 2 months, I have been the health officer for St. Croix County. So the public health system in the state of Wisconsin across our nation, is a complicated one, and there's various different structures, if you will, that state and local health departments have. In Wisconsin, generally, the local health officer's role is really to administer our state Wisconsin statutes, as well as the administrative rules set forth by the Department of Health Services at the state level, and as well as any local ordinances that we have locally. That is the role of the health officer, as well as hiring qualified personnel to fill all the various jobs within the health department, investigating potential unsanitary conditions, human health hazards, communicable diseases, which our conversation will get into today, I'm sure.
Okay. And so I guess I should also ask each of you your education and training and experience maybe before you came to the current job. So Kelli, you're on the screen. We'll start with you as far as education, training, and background.
Sure. So in 2007, I graduated from Viterbo University with a bachelor in nursing. I then found a love for public health and have worked for tribal and local health departments in Northwest Wisconsin. I realized that I wanted to further my education and get a master's in public health. So in the summer of 2018, I finished a MPH, Master of Public Health, at the University of Minnesota Twin Cities, which qualifies me to be the health officer in a local health department, a level 3 local health department, which is what we are in St. Croix County.
And Ellie, your training and background?
Yeah, my training, I have a master's of science in public health from Johns Hopkins University out in Baltimore. That basically means I had rigorous study in epidemiology and in biostatistics. So that is the understanding of disease and disease progression, as well as the understanding of numbers and how to analyze numbers in order to, and present them in order to provide statements or on the trends and there's a lot of language that goes into epidemiology and biostatistics. But since then, prior to this, I have worked in multiple large-scale research trials in anywhere from internationally and with local partners here, the University of Minnesota and Johns Hopkins, in a variety of topics, looking at female empowerment, communicable diseases, chronic diseases such as COPD and lung disease. So I've really had a great breadth and width of topics in which to work in.
Okay, great. Well, and we know since you've been hired just specific to the current pandemic, I guess I'll shoot it back to Kelli as far as what her job was like before and then how it was changed. So it's a two-part question, but if you would describe, Kelli, what you did more or less on a daily or in a weekly basis, and then how that all changed with COVID-19.
Sure, that's a really good question, Jamie. Public health, one of the reasons that I wanted to be a public health nurse before becoming health officer, it's a variety of activities that we do at a local health department pre-pandemic. We are involved in multiple aspects a person's of our community. So we have in our health department here at St. Croix County, I think of many divisions within our health department. We are a pretty small health department for the size of our jurisdiction of St. Croix County. We have a nutrition division that focuses on implementation of women, infants, and children, better known as WIC, which is a nutritional and educational program. We also have another that looks at sanitation and health conditions of licensed businesses within our community. And we employ environmental health specialists or registered sanitarians that are responsible for making sure kitchens, tattoo parlors, pools, hotels are all meeting they are supposed to be operating under. We also have a public health nursing division that really focuses a lot on families and the systems in which our communities thrive, and as well as all of our communicable disease follow-up. We've been follow-up in the state of Wisconsin and St. Croix County for many, many years. And this pandemic has really brought attention to that. We kind of have always been in the background related to communicable disease follow-up and what that means and the role of the local public health. So my job before the pandemic is really to organize those different divisions and make sure as a department we are operating as efficiently and effectively as possible within our given budget amount.
Okay. And so now how did all of that change? Obviously you hired Kelli. Did you have to hire other staff? And, how did the priorities get shifted, if you will?
You bet. So our priorities absolutely shifted. I would say for sure by May. I always tease and say I wish we had a really nice timeline of when this all happened because it feels like we've been doing this for 5 years. In actuality, we're only going on month 10. Our job really shifted, I would say May, and we had everyone in our department focusing on COVID, which included public health lane has really been identifying diseases, and we identify them through the Wisconsin Electronic Disease Surveillance System. All hospitals and clinics and labs report into that system, so we know who positive cases are, and we do the contact tracing and disease investigation via that system. So we needed all of our 16 full-time employees doing that work for sure. Yeah.
And so I guess they say stuff rolls downhill quite a bit, and others would argue that maybe there was a lack of some early leadership on the national level, leaving it quite a bit up to the states. I won't get into the details or any, political comments on that, but still, obviously, you mentioned earlier, just generally, your job is a lot of coordination of local codes and ordinances with the state health code. And so you have to be in really close contact with the state health officials, I imagine.
You bet. And that I explained a little bit. Each state is really different in how they operate the public health system. In the state of Wisconsin, I think as locals, we feel we have shared responsibility. We execute operations at a local level, but we definitely rely on our state as a critical partner to help lead and guide us to what we should be doing in specific cases of communicable disease outbreak like COVID.
Right. And you had mentioned too about working with schools, and maybe that, I can't remember now if that was you or Ellie that mentioned that, but this is one area that I know, having been on the school board now for this last year, that we're looking for the Department of Public Instruction to be making recommendations, or the state health department to be saying, should we be testing students and so forth. And sometimes there's not always a clear, concise, direct answer to that. And so then we try to look to the local folks and so forth. So how have you navigated your way in trying to go from making recommendations to strong suggestions, and what's the difference between that and some type of mandate?
Yeah, that is a great question. And I say specifically for me locally in St. Croix County, I have relied heavily on our county's corporation council, so our county lawyers, as well as administration, and then our Health and Human Service board. So we are governed by a Health and Human Service committee in St. Croix County. So we rely definitely heavy on those partnerships. So it's never a decision of one person having power or making decisions for the entire county on their own.
That's good to know. So let's, if we can, I think this is a good time to go to the website. Well, the data windshield, what do you call that?
Dashboard.
Dashboard. Thank you. I was going to call it a windshield, but the dashboard, if you will. But it's a place where I think a lot of the public were going to. They were curious. My wife is in health, and she's a psychologist, but still very much watching the numbers and so forth. So if we can, if our producer, Nate, can give some screen sharing, you got that opportunity. Why don't we go to the website, because it's changed substantially in the last month or so. And I know I'm one person, I still don't know all what is there for information. So if you could kind of run us through, what information are you trying to share with folks by having this dashboard?
Mm-hmm. Yeah, thanks, Jamie. So where do you find the dashboard? If you are just hearing about that St. Croix County has a data dashboard, just go ahead and go to the St. Croix County, Wisconsin website. You'll click here, more information about COVID. As you scroll down, this first link here is our data dashboard. Now, as was mentioned, our data dashboard has changed. We initially had a much smaller one-page dashboard, but unfortunately it wasn't as intuitive and the graphics were hard to see and it didn't have the ability to contain much information. We were really limited in what it was showing and what it was sharing with the community. And so we worked towards developing something better. And let's see if I can make this, there we are. And so here you have the first page of our COVID-19 dashboard, which is a summary. And so what the summary is just a quick snapshot. So it's showing you our total number of cases. This is any St. Croix County resident who has tested positive for COVID-19. These individuals are counted only once. And then we have our current hospitalizations, and this is within Western Wisconsin hospitals. That's explained more on the hospitalization page, which is linked at the top.
Okay, and if you could, only because I can't read backwards, and that's what I'm seeing as a backward images. What is today's, I'm assuming this is today's most current information?
No, actually, Jamie, this is yesterday's information because as you understand, cases continually roll in. And so we have summarized yesterday for today.
Gotcha. Okay, thank you for explaining that. And so that current hospitalizations would be as of yesterday. How many is that?
That's 16.
Okay. And that's down quite a bit.
That is down quite a bit. Yep. So across the hospitals in the area, we are seeing the numbers continually going off. After Governor Evers put in on November 20th, a new measure because our hospitals were in Wisconsin, across Wisconsin, were facing capacity and we're really struggling. And since that point, kind of that early November period, we have since about the end of November seen a gradual reduction in the current hospitalization numbers.
If I can jump in and ask a little questions, because I'm curious, that number, right now we see it 19. And if people were looking earlier, I know it was in the high 20s, even went to 32, I think one day I saw it at. So it's roughly half of where it was at its peak, maybe. But still, I don't know, is that a good number or what does it mean to be at 16? And when you say Western Wisconsin hospitals, are we talking just in St. Croix County? Is that,
Right. So let's go. I don't know if you can see or if it's working for everyone to see, but across the top are the different areas that are included and they're all linked. So currently we're on the summary page. So if we go ahead and click the link to the hospitalization page, that will bring us to the hospitalizations. Now the Western Wisconsin hospitals are listed on the bottom and they range from north from the St. Croix Regional Medical Center in St. Croix Falls, to Baldwin at Western Wisconsin Health and River Falls all the way down in River Falls. So they include our regional here on the Western Wisconsin. So Polk, Pierce, and St. Croix County hospitals.
So that's not just everybody at those hospitals. It's the people at those hospitals that claim residency in St. Croix County?
No, it's anyone that is currently admitted.
Okay.
We do, and on our previous dashboard, we did have current hospitalizations of St. Croix County residents, which were currently admitted in local hospitals and currently admitted in external hospitals. But unfortunately, the situation did become an issue where tracking and making sure we were presenting absolute correct data. We were not always able to do that because we had so many cases and and there was a lot of tracking to be done. Therefore, we have currently switched to this model, which is coming directly from the hospitals, and therefore it is gaining us a picture of kind of what is the capacity looking like. And so we have the inpatient beds available. So is COVID really maxing out our hospitals right now?
So what would be a number that you would consider dangerous, if you will, or alarming, something where, some type of emergency measures would need to be taken and so forth? If currently it's at 16 and it was at 32, what number would be something that where it would require a powwow with officials and so forth?
Well, I will field that question if you don't mind, Ellie. I really go by an indicator of when the hospital see in a panic and says, hey, we need to do something. We're at capacity. So I do think it's important that everybody knows we, public health, we're kind of, one of the things I failed to mention is one of our critical roles is we do convene critical partners in all different aspects of health. But specific to this pandemic, we mentioned schools. The other critical partner we're meeting with on a weekly basis are the hospital CEOs for Pierce, Polk, and St. Croix counties. So I'm hesitant to give you a number because really only the hospitals, I would not want to answer for them. And really they are the ones that should be giving an actual number. We're kind of just the collaborator convener type role.
And that's fair. So you're not interpreting this data or trying to give them any message other than these are the counts you're given by these hospitals, but they don't necessarily say, they don't give you two numbers. They don't say, here's our capacity and here's the number of hospitalizations for COVID, correct?
Correct. They are the ones supplying these numbers. They are the source. And I guess I wouldn't look at how many are admitted. I would look at beds available, because let's think about COVID not only affects those people currently in the hospital with COVID seeking care, but it also affects individuals who work in the healthcare system and may not be able to work due to a positive COVID infection. And so there's a bigger picture than just the current positive patients. I think patient beds available is a great indicator where we have an indicator here for number of beds. I wouldn't like to see it anywhere out of green. I wouldn't like it to see in yellow or in red.
Very good. And thank you for that color coding for maybe folks who are colorblind, though. I mean, that's right now they can feel pretty good that it's at least in the green and it's not yellow and red. If we can move over to the other statistic on that main dashboard, which you've got up there, is deaths. Fortunately, it hasn't increased too much real recently. Unfortunately, it is a number that is real and it's cost 27 people. But if you could explain a little bit, are those persons who have passed away that just happen to have COVID, or does COVID have to be a primary cause of death? If you could explain that a little bit.
Right. And unfortunately, this number did increase by 2 since the beginning of last week. Okay. But with these deaths, we do not mark them as a COVID-19 death. And there is a kind of blurb here, which says total deaths with COVID as a cause or contributing factor to death. What that means is that we have verified by a death certificate, which has either been provided to us by the hospital or by our medical examiner's office here for St. Croix County. And we have seen that COVID-19 was listed as a cause of death.
Okay.
Contributing factor. Yep. And the other thing I just wanted to bring up quickly is if anyone does have more in-depth questions about what do these numbers really mean, every page on the top right-hand corner has a link to our data FAQs, where anything listed in this dashboard is explained at pretty detailed level.
Excellent. Thank you for pointing that out, and we will remember that there's tabs, so it's not like it's a single page like the previous website. This allows you to go to places, get FAQs, and maybe get a little better explanation of the meaning of some of these numbers. But if you could just explain briefly, as far as percentage of positive tests, it's a statistic that I've personally haven't understood its significance, because to me, if that number gets high, in my view, it's just we're not testing enough people. But if you test only people who are symptomatic, then you're going to get maybe a different number. So tell me a little bit more. How is this a helpful number to the general public?
And I think you're right, exactly on point with the interpretation, Jamie. And that's kind of what we want people to know, that of the people testing positive, now these are by PCR tests, which is not the rapid antigen that comes back within 15 minutes. This is the test where you have to get your results the next day or the day following. of those tested, 23% of them are becoming positive. What that means is that that is still quite high. It means we're finding a lot of disease in everyone who is testing. And if people are seeking care because they want to get tested, that's kind of the general thought right now, to get tested. But the state of Wisconsin is starting, and we here in St. Croix County have opened up free testing sites. State of Wisconsin is doing a send home kit as well, because we do want people testing and being able to test should they feel like they've been exposed or they do have symptoms. And so we're hoping we're not limiting, but we are here still finding quite a bit of disease. Now, our testing numbers have really dropped off, as you can see by the graph. If we look here, in November, the bars are stacked together. So if we just want to look at the positive tests, we can go ahead and remove the negative tests. And so we can see that our positive tests have dropped off in number. So the number of positive tests we're finding, but that percentage is remaining nearly steady. It has dropped off now recently, which is great to see, but it had been staying even during our peak months. Our percent positive is staying steady. So we're still finding the same amount of disease in our community. We're just having less people test.
Okay, very good. Can you now, so each of you can answer this, I guess. What scares you or causes you the greatest concern? I guess while you're screen sharing, I should finish with that though, shouldn't I? Anything more that you wanted to share, Ellie, with
yeah, I just am going to run through our current status. So this is absolute. So summary is the first page, and then you click on the second tab and go down to current status. This is just giving you the snapshot where we're at. And this is a risk level indicator, which we've used. It's a Harvard model, which tells us kind of a risk level we're at. We're currently at orange. This will link you out to more information. And I would encourage everyone to really go through the dashboard and click on all the tabs, because there is a lot of information that we've been able to contain in here for you. And we will continue to develop this as we hope to include even more measures as vaccination data comes forward. So this is a continually evolving tool for St. Croix County residents to understand the COVID response and kind of the current situation.
Do you foresee adding a page that relates to like number of vaccinations administered or
Yes.
anything? Okay. So if there's not anything more you want to share on that, just again, if you could tell the folks where to find this dashboard.
Yep. So if you just head to our St. Croix County website, if you just Google St. Croix County COVID dashboard, it will pop up. But if you go to the St. Croix County website, you click on the COVID page, and it will be the first link as you scroll here, the data dashboard. There are also lots of great resources here. So if you do test positive or you do believe you were a close contact, there's information. There's testing information, where to go and get a test. There is all our initial vaccine information is included. So I encourage everyone to check it out, and hopefully it is helpful.
All right, thank you, Ellie.
Mm-hmm.
And now you can stop the screen share, and we'll just then flow into a question for both of you to answer separately is fine. What scares you the most or causes you the greatest concern about maybe where we are at currently and moving forward as you see the next 30, 60 days?
Do you want me to start, Kelly? Sure. Okay. What scares me the most? What scares me the most is that I feel like so many people have been trying to stay safe for so long, and that can be really tiring. And our numbers are going down, which is helpful, but we just finished a holiday season And I know it's been really hard for individuals to make it through, whether it's employment, whether it's financially, whether it's the hard piece of distance with a family. And I want to recognize what scares me the most is I don't want people to kind of end and just say, oh, I can't do this anymore, because there are simple measures that really do work. And so I would like people to just, I know winter's here and it's going to be hard, but I would like to understand that vaccine is coming, but it's not really here for the majority of us. And so the general public really needs to stick with the measures, the masking, the social distance, and just know that we're getting through this, but we are not through it by any means.
Okay, so don't let your guard down, and just because a very small percentage of people are starting to get the vaccine.
Mm-hmm.
Okay. And Kelli, how about you? What frustrates you or causes you concern about the pandemic at the current stage?
Oh, here I thought I was going to get to report on what scares me the most.
Yeah, you can do that too. Yes. Okay.
One of the things I just want to be clear about is I think during this response, we have heard a number of sentiments related to this is the common cold. Let me be clear. This is cold. This is novel. This is new. Yes, it is a coronavirus. We have many circulating in our communities every year, but this is novel. This is new. And one of the biggest things that make me nervous is the unknown. We don't know long-term effects of all the different disease processes that this virus can have on one's body. And that's probably one of the things that scare me the most, long-term impacts. Frustrating things. Well, I have a long laundry list of things that frustrate me during the pandemic. And I think probably the biggest one that sticks out for me is not being able to really fix everything very quickly and very easily. Unfortunately, this virus has been politicized. I try to stay very, I'm here to do my job, whichever side I believe or, look at. And I think that's one of the hardest things for me as the health officer to know. I just want to keep people safe and healthy.
All right, very good. Now, as far as the recommendation for masks, there was none in March. We came out of the Wisconsin lockdown after the Supreme Court struck down the governor's actions to attempt to renew the state emergency. And then it felt like, well, that meant everything could kind of open up. And it wasn't another month before finally then masks came out as a recommendation. What do you foresee as far as when will people be able to relax, so to speak? I think that was kind of Ellie's concern or fear, was people will start to relax just because there's talk about vaccines getting out. But do you think that the idea of wearing masks, particularly indoors, is going to be with us for a while?
Yeah, absolutely. Ellie, let me just say a couple bits and you sure can jump in. I think one of the things I really want people listening to this to understand is that after you get a vaccine, it does not mean that these measures Ellie discussed earlier go away, unfortunately. We know social distancing, wearing masks, staying home when you're sick are all things that do help COVID-19. And I don't foresee those goals. It's not a quick fix. We're a society that wants a quick fix. And unfortunately, this pandemic has not presented itself with a quick fix.
Ellie, do you have anything to add to that?
Thank you. I do, just that we as the general population who aren't in a priority group, our vaccine administration is going to be a while in coming. And so I think there's still pieces to be worked out with rollout of the vaccine and the appropriation and the organization And all of that's being done, like Kelli said, as soon as we are able right now, but not all those pieces are there. And so even to give a timeline for people, I would just say it's coming, but I couldn't give you an expectation in the future of a date that I would say.
So continue to keep your guard up is the message. And, we're learning every day. Just this week, news came out that what was thought to be contained in the UK has now spread to many countries as far as another variant. And I doubt that you can share with us any information that would give us confidence that the vaccines that have been developed over the last 9 months are now going to be able to be successful in warding off this new variant. Do we even know enough about that?
We do not.
Okay.
I do not have access to that.
I do not either. And not at this time, I don't have that information.
Right. And while in a best case scenario, we'd be able to keep it from this country, but it doesn't sound, I was listening to Dr. Fauci and he wasn't super optimistic that would be the case. And so your message seems to be consistent with him and what's coming out of the CDC. Is that intentional? That consistency?
You bet. I think anytime we strive, when you have so many different critical stakeholders responding to COVID-19, communication consistency is absolutely, I think it's definitely a goal I have for St. Croix County. And I hope all stakeholders have that same goal. We don't want 100 different messages that contradict each other. And we have seen that in the response, and it's unfortunate. And I can't give a good explanation, and maybe just a little piece of rationale is it is new, it is novel. We are learning things all the time. And unfortunately, that leads to different outlets communicating different information.
All right. Well, we'll just end here, and that is we've kind of explained quite a bit about the website. So if people do have questions, or if they start hearing rumors and they want, before they start believing something that they just hear off the street, what should they do? What should the typical person do?
So I think people in St. Croix County can absolutely use our source and the links we have on our website as kind of a landing point. I would also definitely recommend DHS, Wisconsin DHS. And because we are a border county, it's been interesting to watch MDH, Minnesota State Department of Health, and the communications they put out. You can definitely tell there is a little bit of a different response and prioritization in the response. But those two websites are great, and as well as the CDC are things that we follow in public health.
Well, Ellie, anything to add to that?
Yeah, I would just add, if you read something on the internet or there is a link to something, I think the rules that apply for determining the validity of that piece of information is there a source? Where are they getting this information? And can you trace that source to a website that is something that's nationally recognized, like the CDC or a higher education institution? And then does it have an author? And if you do a quick search of that author, are they a reputable scientist in their own field? Do they have a background profile? And I think it's just kind of a good thumb to just not believe everything you read or hear.
Yeah. Just because it's on the internet doesn't make it true, right?
Correct.
All right. Well, thank you for your time. And I want to thank both of you for your service to our county. You play very important roles, and we appreciate that. And I have a feeling that we may need you back on the show in 5 or 6 months. Can you do that for us?
You bet. Even less. As vaccine planning rolls out and things change, you bet.
Okay. Well, yeah, because I'll be curious to see how the vaccines go, about what happens with these variants and what happens with testing, because, there are tests that are being administered now that weren't even thought of 9 months ago. And testing could make a huge difference on how soon we can get back to quote unquote normal again, right?
You bet.
Right.
All right, very good. Well, thank you, Kelly and Ellie, and I want to thank our viewers for watching, for listening, and for asking good questions and seeking out accurate information. Keep watching.